the Aleutians during the war, and they ended up firing on each other because the Japs had already evacuated the island.
Oh. Okay. All right. So, there, when you were in Colorado, and did you have similar duties in the dispensary?
Yeah, I was. In Colorado, I was working at the hospital rather than a dispensary,
Okay.
and I was in charge of several pneumonia wards. We had a large pneumonia population in the hospital.
Okay.
The only antibiotic we had at that time was sulfanilamide. Penicillin hadn't been invented yet.
Oh, okay. All right. Why did you have so much pneumonia? Were these from the individuals from the Pacific, from the war? Were they
No, this
local?
was because of the mountains, the cold.
Oh, okay.
And that area had a large amount of rheumatic fever as a result of strep infection.
Oh. Had you been prepared for this? Did the Army prepare you? Or did you learn most of your medicine from med school?
I had spent, before I got into service, about 9 months out of the year as a resident at Herman Kiefer Hospital in chest disease.
Oh, okay.
So I was basically assigned to read the chest x-rays because they didn't have a radiologist up there.
Wow.
And at one point in time, the Army decided that they were going to have rehabilitation. So I was assigned as a rehabilitator.
Oh, okay.
Without any idea what to do.
Oh, about like that kitchen inspection.
So the whole idea was to try and get the soldiers from the hospital to duty with sort of an area where they were having some exercise to help them get over the fact that they were in bed for a long period of time. Especially if they were pneumonia, they were in the hospital sometimes for a couple of weeks.
Wow, yeah. And I know you indicated you were at Herman Kiefer. Did the Army typically send their doctors or train their doctors internally on
Some were trained.
Oh, okay.
One classmate of mine was trained in radiology. And let's see, one was trained in psychiatry. They sent him they had a 3-month course that made him an expert.
Oh. They had to turn him over pretty quick.
Yeah.
Yeah, you had a special need, so they, yeah. Was Colorado how long did you stay in Colorado?
I was there for about 9 months too.
About 9 months, okay.
And then I was transferred, still in Colorado, to camp. It was just outside of Colorado Springs. Take a look at
Fort Carson.
Fort Carson.
Okay. Yeah.
It wasn't a fort then, it was just a camp.
Okay. Okay. And what was that like? How was that doing?
Well, there again, I was assigned to the hospital.
Okay.
See, all of these duties were considered part of what they called station complement.
Oh, okay.
That separate from the units that were being trained or came back. In Colorado, they had a lot of people returning that were up in the Aleutians.
Oh, okay. All right. All right. Of each of these assignments, other than dealing with the pneumonia in Fort Campbell, were all your assignments kind of similar, or did they kind of blend as far as your duties that you had to